The industry is cautiously optimistic, and this notion of optimism is a bit complicated. And why do I say that? If you look at the last 5 years, and especially 2025, I would put this as a mode where the industry looked at from moving from recovery to reinvention. And that was especially, there was so much progress, so much new innovation, product pipelines and launches. But the reality is we are still dealing with the complexities of regulatory uncertainty and policy changes, not to mention the geopolitical issues which we are facing, all the time.
We have a great opportunity with one of the components of the One Big Beautiful Bill Act, and that was the allocation of $50 billion to be allocated towards rural hospitals. And that's going to be doled out $10 billion a year for the next 5 years. And states are just now being notified by the CMS of their funds allocated for this year alone. And they are in the neighborhood of approximately $200 million each state for this year. So for the technology providers, this is a great opportunity.
Organizations are starting to realize that they need to really operationalize the accumulation of this omics data. So historically, if you look at what has happened, omics data was used as a point solution. You run a test, you diagnose an individual or patient of cohorts, you make a therapeutic decision, and that is it. But now organizations have millions of files. They can easily query across them, combine them with clinical data, or feed them into the AI models without sort of massive data engineering projects. So now organizations are realizing the need to operationalize their omics data into what we call reusable enterprise data assets, because now that has to feel the ongoing intelligence of being able to query, being able to cohort your patients, and feed that into AI with the goal of reaching scientific insights as quickly as you possibly can.
When I talk about that consumer, I think they are so much more educated, so much more willing and wanting to access information on their health. They are so much more curious than they were a decade ago, that they're prepped and ready for any tool that can, give them more answers, that can empower them, that can take them, one step closer to having more autonomy in this very chaotic healthcare world that we are in right now.
Now, from an imaging perspective, as procedures move more minimally invasive, there's increased opportunity for imaging. Now, particularly where I sit in intravascular imaging and speaking from a coronary space, it's a good story there. Last year, our societies gave Class 1A recommendation for routine use of intravascular imaging in complex coronary procedures. So what that means is that there's strong evidence that is promoting usage of imaging as part of the procedure. And if you just look at opportunities, there are about 1 million procedures, like coronary artery procedures that require stenting are done. And only 25-30% of those procedures are currently using intravascular imaging. So you just see the opportunity. So it's such a huge market development opportunity there.
People don't want changes in their workflow, but in reality, 5 years from now, AI, if we're going to really leverage it, we're going to have to change workflows. I mean, we're going to have to. Agentic AI is going to, change them by nature.